Ladies and gentlemen, a very good morning to you all. This is Tausif, back with a new live stream, and the topic that I'm going to be discussing today is something of great concern. And I'm hoping that you'll be tuning in to pay attention to what I'm going to say and also share your thoughts with me about this matter. My friends, the time right now is 12:45 a.m., 45 minutes past midnight, and the date is February the 6th of 2026. My friends, have you heard of the Nipah virus? That's a question that I'm going to ask you at the very beginning of this live stream because your answer matters. Before I provide to you the information about the Nipah virus, I just want to know how many people are already aware of the presence of this virus, or maybe you don't know the details, but you've just heard that there's a virus like this that's called the Nipah virus. Because, I think that not enough is being discussed about this. You turn on the news, you're going to see a lot of other things going on in the world and in the United States, but not a lot of discussion about the Nipah virus. And I'm going to share with you why it is so important to discuss the ongoing situation surrounding the Nipah virus. This virus, let me tell you, this is a dangerous virus. It's a deadly virus. And you know what? There's already widespread fear about this virus in Asia. That's right. Now, some of you might say, oh, it's in Asia. We're here in North America, so we're probably doing okay. Hey, listen, we've seen that a virus can cause unrest all over the world, okay? A virus can spread. People travel back and forth all over the world for business, for work, for tourism. And so when we're talking about a virus, there's a great deal of uncertainty. Now, I'm not saying that there's something to be worried about. And I'm not saying don't worry. I'm just going to give you the information. And I'm not a medical professional, okay? I did study healthcare policy, but I'm not a doctor. I don't have clinical training. And so whatever I'm sharing with you, I'm just sharing as an informed individual, somebody who's trying to obtain more information, be more aware of this, gather more knowledge about this. And so, if you want to know more, you got to go talk to a scientist you can trust. As we've seen, you can't trust every scientist because, we've seen that scientists can also share information based on what they think is politically advantageous. So, I'll let you make that judgment, who you trust. But if you want to know more details about this virus, like the scientific details, you got to go talk to a person who's busy in the study of science every day. So anyway, let's continue. There's already widespread fear about this virus, about this Nipah virus in Asia. And here in the United States, not many people are paying attention to this news. And I believe that everyone should at least pay attention to what this virus is. Yes, it's in Asia. That's where all the concerns are. We're here in North America. But you know what? You should pay attention. At least find out what this Nipah virus is, what kind of danger it might pose if there's a big outbreak. This Nipah virus, I can tell you this is deadly, okay? This is deadly, and we know that in this day and age, because of how far people travel in a matter of hours, okay? I mean, in a matter of hours, you could be on another continent. And so people can travel a very long distance in a very short span of time. A lot of people travel. The volume of travel all over the world is enormous. And that's why I'm very concerned that this virus may spread. Who knows? By the way, let me just greet some of the friends who are here. Okay, before I continue. Selena is here. Hi, Selena. Good to see you. We got Salerno. Salerno is here. We got Edwin. Edwin, good to see you. Salerno, thanks for being here, for supporting this channel. We got Kay Cooper. Always Kay Cooper from the great state of Texas. Thank you, Kay. Kay Cooper is such a wonderful supporter, a great friend of this community of freedom-loving people. So, Kay, welcome. We got Frank here. And we got other people. Who am I missing? I see a lot of other names. So if I missed somebody, I apologize. But you know that I try to welcome most people. Can't go through all the names, but most people. So, oh, Kathy is here. Kathy Robbins. All right, Kathy, welcome. And who else do we have? Did I miss anyone? All right, we'll see. Okay, anyway, if I'm mismentioning your name, I apologize, but you all are so very welcome. So thanks for being here. Okay, so it's a deadly virus. And if you look at the website of the Centers for Disease Control and Prevention, so, known as the CDC, if you look for information about the Nipah virus on the CDC website, you'll find that Nipah is a serious and sometimes deadly viral disease. Now, the Nipah virus, it is spread by fruit bats, and the virus can make human beings and animals sick. It's a virus that affects both humans and animals. There's also information about human transmission, so the virus can spread from one human to another. And Nipah virus is now causing a lot of headache in Asia. People are extremely worried, okay, because there's been an outbreak. And perhaps the most scary information is the following. Listen, before I share with you the information that I'm going to share with you now in a few seconds, I want you all to pay attention. There's a reason why I am talking about the Nipah virus. And the data that I'm going to share with you now, in just a few moments, it'll tell you exactly why we should all be concerned. Are you ready for the information? Are you ready? Okay, let me share that with you. Reportedly, anywhere from 40 to 70% of the affected people die from this virus. I'll let you process that, because I know it's extremely shocking. So the people who are affected by this virus, people who are infected by this Nipah virus, 40 to 70% of those people may die. Okay, so this is scary. This is scary. This is extremely scary. Okay, someone's saying we can't hear you. You can hear me. I know that. I know you can hear me. I know it. Okay, let's do a test. All those people who are watching this, can you hear me? Kay Cooper, can you hear me? Yeah, it's working. It's working. Listen, I get this. There's this disruption strategy, okay? Somebody comes in and says, "Oh, we can't hear you." And you know what? I get it. It's not going to work on me. If anyone can't hear me, it's probably an issue with your speaker or with your headphone or earphones, whatever you're using, okay? But I know everyone can hear me, okay? So, my friends, that's right, 40 to 70% of the people die if infected by this Nipah virus. It is a scary number. It is a scary number. What this means is that more than half of the affected people die from this virus. Right at this moment as we speak, there is fear in Asia regarding this deadly Nipah virus. There's tremendous fear. If you have not been paying attention because it's in Asia, maybe you're focused more on domestic issues in the United States. That's all right. It's okay. We can't keep track of everything, right? I mean, I discuss a lot of different issues on this channel, but I cannot cover each and every topic. There are topics that I have not covered or I can't cover because it's just there's just too much going on. So I always have to pick and choose. I mean, listen, on any given day, there are at least 5 topics that I can discuss. But I can't because there's not enough time in a live stream. So I have to pick one important topic, maybe 2, and then depending on what questions people ask, we go into other topics, of course. So it's okay if you are not aware of the Nipah virus yet. That's why I'm doing this live stream. And now that you know, please do a little bit of your own research. Keep track of the updates regarding this Nipah virus. I mean, there are reports there are 2 cases of Nipah virus in India. Yeah, that's right. In India, 2 confirmed cases of Nipah virus. 2 confirmed cases, okay? There could be more. There could be more. But 2 confirmed cases. This is what's called a zoonotic virus, which means it can go from animals to humans. And that's always scary, okay? You don't have to be a virus expert to know this. This is, I think anyone with common sense can figure this out. If there's a virus that affects animals, and then it can go from animals to humans, if it can make that leap, if it can make that jump, that the virus goes from an animal to a human, that's scary. That is extremely dangerous. And then it spreads from humans to humans. My friends, reportedly, it can take up to 14 days for symptoms to appear after initial infection. So somebody could be infected, and then it could take 14 days. Not always. I'm sure it can be less, or maybe more. I don't know. But 14 days. So somebody infected can be out and about, interacting with people, living in society, coming in contact with other human beings and not know that there's this infection. So it can take days for the symptoms to appear after initial infection. And so what that does is it just creates a greater risk of a virus spreading. Let's say there's a virus as soon as an individual is infected, maybe the very next day the symptoms appear, or maybe in 2 days the symptoms appear, and then something's wrong, and the person can go get treatment. But if it takes 14 days, if it takes a longer period of time for symptoms to appear, then the person can be infected and then not know that there's something wrong, that there's a virus that's gaining strength because there are no symptoms. It takes days for the symptoms to start. So that's why I'm sharing all of this with you through this live stream, because it's about raising awareness. Okay? So what are the symptoms? Okay, that's a logical question you can ask. What are the symptoms? Well, the symptoms of NIPAH could be flu-like. So what are we talking about? Fever, headache, sore throat, muscle pain, etc. Some respiratory symptoms can be seen, like cough, for example. I mean, this is real scary stuff. Okay? And reportedly, this virus can also cause damage to the human brain. Okay? I mean, if you want to know more, I strongly encourage you to do some research. Find out more about this virus. Look at the studies and the authentic sources of information. Or you know what? Talk to a doctor. Talk to a doctor to learn more about this. So right now, as I have said, people are concerned in Asia. People are extremely concerned. They are worried in Asia. Okay, by the way, I know people from all over the world tune in for these live streams. So is there anyone from Asia watching this? Anyone from Asia watching this live stream? I want to hear from you. Anyone from Asia? Do you live in an Asian country? Do you live in India? Do you live in Malaysia? Do you live in Thailand? Do you live in Bangladesh? Do you live in Singapore? Do you live in Pakistan? Do you live in Myanmar? You live in China, and anywhere in that region. Maybe you don't live, but you're visiting. Let me know in the live chat. Okay? All right. Go ahead, let me know. So my friends, you look at India, that's where 2 cases have been detected. And so the other countries in that region are also very concerned, like Bangladesh, where I'm originally from. People are very concerned in Bangladesh about the Nipah virus. That's where I grew up. That's where I was born and raised, in Bangladesh. People in Malaysia are concerned. People in Philippines concerned. Also in Singapore, extremely worried. And then, China and Thailand and also Cambodia. There's fear in Cambodia. There's fear in Thailand. And so in India, I mentioned 2 cases have been confirmed. The 2 confirmed cases so far have been in Kolkata. Okay, that's in West Bengal, in Kolkata. And reportedly, Thailand and Pakistan have introduced health screenings at international airports. Okay. They're screening. They're doing screening to try to reduce the risk of uh, this virus. And anywhere from any of those countries? Anyone from any of those countries? Go ahead. Go ahead. Let me know. Okay, someone's asking, why did we leave the World Health Organization? All right, listen. You want to talk about the World Health Organization? I'm going to talk about the World Health Organization. Great question. You brought up the World Health Organization. I mean, listen, my friends, what's your opinion about World Health Organization? They call it WHO in short, WHO, WHO. Like when you're asking, oh, what is the WHO doing? And people get confused, like, who? Who's who? Well, oh, sorry. We're talking about the World Health Organization, WHO. What is the World Health Organization doing? Listen, my friends. The World Health Organization, okay? If you listen to the World Health Organization, do you know what they're going to tell you about the Nipah virus? Any idea? Have you read the statements from the World Health Organization about Nipah? You know what? If you don't know much about the organization and somebody says, "Oh, the World Health Organization is doing, all these studies they're putting out," you think, "Oh my God, what a great organization, the World Health Organization. They are there to promote health. They want people to be healthy all around the world, and that's why we call them the World Health Organization." Listen, do you really trust everything that the World Health Organization says? Like the World Health Organization puts out a statement. Oh, here's a statement regarding a virus or an issue. Do you trust every piece of information that the World Health Organization is publishing? Really? You do? You do? If you do, great. Congratulations. What can I say other than congratulations? Oh, I trust everything that the World Health Organization, this amazing organization that promotes health and wellness all over the world, whatever they say, I trust it 100%, no doubt, no questions, I'm not going to be skeptical. No need to verify anything, just whatever they say, oh, it's awesome. No, you can't. I mean, I don't know what you can or can't. I don't trust everything that the World Health Organization says. I'm not saying they are wrong 100%. No, I won't say that. Okay, because that won't be fair. What I'm saying is I don't trust the World Health Organization 100%. But I'm not saying my trust level is zero. No, I'm not saying that. It's just that you have to do more research. You have to be informed. You have to be an informed individual. And you have to look at a variety of sources. You have to apply your common sense. You have to study history. You have to know more about the world rather than just simply saying, oh, whatever the World Health Organization says, that's what I'm going to believe 100% without a doubt. If you say that, if that's your stance, if that's your mindset, then I'm sorry. What else can I say? Okay? Someone's saying, "Oh, this guy's actually not actually live." Yeah, this is a live stream. So if anyone's watching this and saying, "Oh, this guy is not actually live," no, this is live. But when I'm talking, I can't read all your comments, obviously. Oh, Steven's here. Steven, good to see you. Steven from Southern Illinois. Beautiful Southern Illinois. So yeah, I don't know about you. I'm not here to change your mind, change your way of thinking. Okay? But what I will tell you is I don't trust the World Health Organization 100%. Okay? I'm not saying I trust them 0%. I'm not saying that. I don't trust them 100%. Because I know there are folks out there who trust the World Health Organization 100%. Oh, the World Health Organization can never be wrong, whatever they say. You got to believe it 100%. No, that's wrong. Okay? That's wrong. You know, at these big organizations, there's a lot of politics too. You know, if you think, oh, in the scientific world, there's no politics, that's wrong. That's wrong. Anyway, so let me tell you what the World Health Organization said regarding this Nipah virus, okay? The World Health Organization, WHO, in short, the World Health Organization says that the risk posed by Nipah is moderate at the subnational level and low at the national, the regional, and global levels. Okay? So it seems to me they're saying, "Oh, don't you worry. Don't you worry about the Nipah virus at the global level. This is the risk is low." Really? Really? I mean, is the risk assessment 100% accurate by the World Health Organization? They're saying, "Oh, at the regional and global level, the risk is low." Okay. I mean, once again, how much do you trust the World Health Organization? I mean, I'll leave that up to you to decide, okay? It's your decision. You make that decision. You can say, "Oh, Tassif, you know what? I just absolutely love the World Health Organization. I trust them." Great. Great. If it's what you believe, go ahead. Or you could say, "You know, Tassif, we can't really trust the World Health Organization 100%. It would be a mistake to say the World Health Organization is always correct. It would be a mistake to think that way." So then you got to ask yourself the next question. Is it possible that the Nipah virus will spread? Is it possible that the virus will spread beyond India? Is it possible that the risk of this virus is higher than what the World Health Organization is saying? These are important questions. You know, in order to learn, in order to gain more knowledge, in order to acquire more information, in order to do more research and search for the truth, you have to start with a question. My friends, reportedly, Thailand and Pakistan have, as I said, introduced health screenings at international airports. Now, is it possible that this dangerous virus could reach the US? Because people are traveling. People are traveling. International travelers going all over the world. And we know that after the initial infection, people could be symptom-free for days. They could be infected and not know that they are infected. And in that duration, if they're coming in contact with other people, they're in large gatherings in crowded areas, and people are sneezing, coming in contact. They are water droplets. When you sneeze, you don't always see it, but there are tiny water droplets everywhere. If somebody sneezes in a crowded area, or if there's transmission from animal to human, human to human, and if people are traveling, could this virus spread beyond India, affect other countries in Asia, go beyond Asia, affect the population in Europe and in North America? I don't know. I don't know. Now, here in Wisconsin, I know that we are dealing with a lot, okay? But, in Wisconsin and also in other states. I mean, right now in Wisconsin, there's a big concern that's measles, okay? A case of measles was detected in, I believe it was in the Waukesha County area, if I'm not mistaken. Let me just double check. Hold on a second. I think it was in Waukesha County. Give me a second. Yeah. So in January, that's last month, there was a confirmed case of measles in Waukesha County. And then we got another news update that there's a confirmed case of measles in Dane County. That's the county where I live. In fact, a confirmed case in the city of Madison. That's the city where I live. So we got confirmed case of measles in Waukesha County, not that far, like an hour from Madison. And then in Madison, another case was detected. So are there other cases out there? Other people infected with measles? They're out there. Maybe we don't know. Is it spreading? So we have a lot. We have a lot to worry about in Wisconsin. And then you got other states dealing with a lot of other problems. And that's on top of the other illnesses that people are dealing with. I mean, people are dealing with influenza. They are dealing with, other viral illnesses, RSV and all that. A lot of people have pneumonia, bacterial. People have bronchitis. People have all these health issues. And that's on top of everything else, like heart disease, cholesterol, other illnesses. So there's a lot going on. And on top of that, now we have to worry about this NIPAH virus, which once again, for those who are tuning in just now and thinking, all right, why are we worried about this? Well, it's because according to according to scientific information that we have, 40 to 70% of the people die if infected by NIPAH virus. Yeah, so we've seen COVID. I mean, COVID, I don't know. I mean, when we talk about COVID, when we talk about coronavirus, you can talk about the actual virus and the illness and the symptoms and everything. And then you can also talk about the political reaction to the COVID outbreak, the politics of COVID. We saw Democrats leaders try to shut down the economy. Democrat mayors, Democrat governors, they imposed stay-at-home orders and forced businesses to shut down, close their doors. The Democrats did all that. Forced people to, close their businesses and stop earning money. I mean, it's unbelievable what kind of mess we saw during those COVID years. It was not just about the actual virus and the science of the virus and the treatment and all that. It was more than that. It was just the politics. There were leaders, Republicans, who were saying, no, we're not going to force businesses to shut down. We're not going to force people to wear masks. We're not going to force people to get the vaccine if they don't want to. Republicans, they always focused on upholding freedom, protecting freedom, medical freedom. But the Democrats, what did they do? They forced people. You gotta wear a mask. You gotta take the vaccine, like it or not. Shut down businesses. So much of damage that we faced, even if you're not a business owner, but you're still part of an economy, this economy. And we've seen the left-wing politicians, we've seen the Democrat mayors and the governors, what they did to this economy. So much of damage. The damage done by the actual virus, that damage was inflated, that damage was, the compounded. The damage done by the virus, it was turned into a bigger damage by poor decision making by government leaders. Yes, there's a virus there that we have to deal with. There's a health response. There's a scientific response. How do we deal with the virus? But then the Democrat politicians, they caused more damage on top of the damage caused by the virus. They caused greater damage through extremely poor decision making. Why would anyone shut down businesses? I mean, the government doesn't own a business. Hardworking Americans own businesses, and the government just came and said, oh, you got to close your doors. Oh, you cannot allow more than, this number of people into your restaurant. Oh, you can't operate. You're non-essential. Close it down. I mean, who decides what's essential, what's non-essential? If you're a small business owner, and let's say you sell fashion accessories, okay? You sell, bags and watches and leather products, belts, you sell shoes, whatever, okay? You sell material stuff, fashion products, and the government comes and says, oh, you're not essential, shut it down. Well, it's essential for you. That business is essential for your survival, for your livelihood. Because it's only when you sell your products, it's only when you're serving customers that you can make money, that you can pay the salaries to your employees, that you can pay for your own health insurance, that you can put food on the table for your children. So every business is essential. There's nothing as, oh, non-essential, you got to shut it down. I mean, the devastation we saw during COVID, and the Democrats caused so much of damage to the economy. It'll never be forgotten. People will never forget what the Democrats did to the US economy during COVID. And the Democrat fear-mongering, all the left-wing radicals, the progressives, the socialists, how they all came together and they caused damage. And we saw the double standards. Didn't we see Gavin Newsom hanging out at an expensive dining establishment, no masks, like having fun, hanging out with buddies. At the same time, when the rest of California was under this COVID order, restrictions, and the governor was just hanging out, enjoying meal. Are we ever going to forget that? Are we ever going to forget that? And it's not just Newsom. The list is long of other Democrat politicians engaging in behavior that revealed their double standards. One rule for their own selves and one rule for the rest of the country. Are we ever going to forget all that? So anyway, now we're looking at a much, much more dangerous virus. I mean, COVID was bad. COVID was bad. A lot of people suffered, a lot of people were hospitalized. A lot of senior citizens in particular, they suffered. But then a lot of people recovered quite easily. There were many people who were infected but really had no symptoms. And they recovered just, without any medical help. And then there were those who ended up in the hospital and they had, even after they recovered from like the initial virus, they had long-term symptoms of illnesses. So we've seen. But understand one thing, this Nipah virus, it's far more deadly than COVID. If you thought COVID was pretty bad, a lot of people would say, oh, they had COVID, but they kind of recovered on their own, so it wasn't that bad for them. Many people, as I said, ended up in the hospital. So there are folks out there who would say, oh, COVID was really bad. And if it was, and if that's what you think, then Nipah is a lot more deadly. As I said, 40 to 70% of those infected die. So if you're scared of COVID, what are you going to say about Nipah? What are you going to say about this Nipah virus? Kay Cooper says it's very serious. It is. Listen, let me tell you regarding COVID. I had COVID. I suffered from COVID. Okay. I remember the fever and the chills. I've been through COVID. Okay. And I can tell you that this Nipah virus is scary at a different level. You can't compare that with COVID. It's very scary. By the way, I believe in natural immunity, just so you know. I did not get the COVID vaccine. Okay? There are people out there who got the vaccine and they're like, oh, now I want the booster 1, booster 2, whatever. I don't even know how many boosters they came up with, okay? I did not get the COVID vaccine. I did not get the COVID vaccine, okay? So yes, I've been through COVID, I've suffered, but I believe in natural immunity. All right. Let's see, who's here? My friends. Okay, by the way, those who are here, have you Have you subscribed yet? No? If you have not subscribed, please do so. We're 45 minutes into the live stream. I'm going to be staying here longer, but make sure that you're subscribing, okay? It's important that you subscribe and be a part of this growing community of freedom-loving people. All right. Anyone here who has not yet subscribed, or if you are a new subscriber, introduce yourself. Say hello. Say hello. All right. So, my friends, back to the question, is it possible that the Nipah virus could reach the United States? How much risk are we really facing here in America? I mean, like I said, if you ask the World Health Organization, if you love WHO, if you love the World Health Organization, well, they're saying that the risk is low at the global level. Do you believe that? Go ahead. There's also a poll question that you can respond to. The question is, how much concerned are you that the Nipah virus may spread and cause a pandemic? The options are, number 1, very concerned. Number 2, somewhat concerned. Number 3, not concerned at all. And number 4, don't know what the Nipah virus is. So choose an option. There's no right answer. There's no wrong answer. Just make a selection. A lot of people are saying not concerned. Okay. Not majority, but like 41% saying not concerned. All right. But then there are people who are saying very concerned or somewhat concerned. So 16 and 17%, which means, yeah, you got 33 roughly, I think. I'm just seeing the numbers get updated. But 33% of the people are saying they're concerned. Okay. It's a mix of very concerned and somewhat concerned, but they're concerned. So 33% of the people saying they're concerned. And so, and then there are there's a large group that's saying that they don't know what the Nipah virus is. Salerno is very concerned. James is saying that he doesn't want to go through another pandemic. Yeah, no one wants to go through another pandemic, okay? Go ahead, make a selection. Let me know what your thoughts are. Matthew is here. Matthew says hello. Hello, Matthew. Thank you for your participation, Matthew. Yeah, share your thoughts in the live chat. Let me know. Let me know what you're thinking. And make sure you're subscribing to stay connected. Matthew is asking, what are the symptoms? So Matthew, I looked it up. The symptoms are, so the symptoms of Nipah, this Nipah virus, the symptoms are, and I mentioned it. Hold on a second. Let me look at the list. The symptoms would be flu-like symptoms. Okay? So flu-like symptoms, fever and headache, etc. So I'm going to have to look up the complete list of the symptoms, I think. But yeah, flu-like symptoms. You got fever, headache, sore throat, muscle pain, respiratory symptoms. Evelyn's here. Hi, Evelyn. Good to see you. That's our friend Evelyn from the great state of Nevada, from Las Vegas. Evelyn, good to see you. Yeah, Evelyn, it's a scary virus. Okay, Evelyn just joined, I think. So let's just give Evelyn a quick update. It's a very scary virus, and 40 to 70% of the people infected die. I mean, this is way more scary than COVID. Way more scary. I mean, it's a different kind of a virus, not the same as COVID, but it's way more scary given the fact that 40 to 70% of the people infected die. Okay, so high rate of death among those infected by Nipah. Right now, it's in Asia, but the question we're asking is, can it spread to the US? Is there a risk of a pandemic? All right. Any more questions for me, my friends? Any more questions for me? We got Fuzz over here, Aaron. Okay. Aaron from Canada, right? Aaron, Canada? Okay. How are things in Alberta? Remember I talked about, okay, now I'm changing subjects, but why not? Why not? It's important, I think. When we talk about Canada, we got to talk about Alberta, and people in Alberta, they are desperate for freedom. They want freedom. They want that province, people in that province, they want to be separate from the rest of Canada. They want their own territory. They want freedom. But of course, I think Alberta would be given a warm welcome if they want to join the Union, which is the United States of America. Right? Yeah, Aaron, you acknowledge that, right? That there are people in Alberta who want freedom. They want to make Alberta separate from Canada, right? People over there. I mean, there are people, passionate people, okay? And the number is growing. More and more people are joining the movement to make Alberta separate. You know, people in Alberta, they are sick and tired. They are sick and tired of the Mark Carney administration, and so people in Alberta are saying it's time for freedom. It's time for freedom. All right. So, my friends, that's pretty much all I have for today. I don't have anything else to add at this time. Obviously, we're going to have to monitor the situation. And if there are updates, I'm going to share those updates with you. Okay? Any other questions for me? If you have questions, I'll stay. Probably not, right? Okay. No questions. Okay. Thank you so very much, my friends. I appreciate you all tuning in for this conversation. Going forward, we have to, um, you know, keep an eye on this situation, the Nipah virus. It is scary. This is a dangerous virus. And I don't trust everything that the World Health Organization says when they say, oh, the risk is low. The risk of, you know, the virus spreading at the global level is low. I don't trust that. I'm not saying they're wrong. I just am not going to close my eyes and trust the World Health Organization. I have to do my own research. I have to talk to people, you know, subject matter experts, and they may have different viewpoints depending on who you talk to. But you know, you can't just blindly trust the World Health Organization. Okay, you cannot do that. So thank you so very much, my friends, for tuning in for this discussion. There's going to be a lot more to discuss going forward, and as I learn more, I will be sharing the information with you. So thank you all so very much. May God bless you all. May God bless President Donald J. Trump. May God bless the Trump administration. May God bless the Republicans in Washington. May God bless the United States of America. May God bless our U.S. allies. And may God bless freedom loving people all over the world. Thank you so very much, my friends. If you have not subscribed yet, please do so. Stay in touch. Tune in for future live streams. And I look forward to more discussion very soon. So thank you so very much. Have a wonderful, well, no longer a good night. Have a wonderful morning. Okay. And I'll see you soon. Thank you.